Okay, thank you so much. I'm Andrea, and I'm going to talk to you about researching researchers, specifically how to ask them sensitive questions, the ones where they have some kind of risk involved. I did my practicum mostly working on SHIFT, which is a research project directed by Dr. Zach Marshall that will be asking researchers about their participatory research practices. So I certainly learned a lot about asking sensitive questions, and I'm excited to share that with you. Because of that experience, I am going to be focusing on patient and public involvement, our researchers that do patient and public involvement. But I hope that you can use what I have here for any research with other researchers or with the general public. A lot of it should apply. I did not find any specific studies on what topics are sensitive for researchers who do patient and public involvement, or how to adapt them. So take what I say with a grain of salt. I've inferred from research on how to adapt sensitive questions for the general public and research on researchers. And yeah, I'm excited to show you what I've learned. Okay. I want to start by recognizing that I live on unceded land in Tiohtià:ke, commonly known as Montreal. Tiohtià:ke is a historical gathering place for many First Nations, but the Kanien'kehá:ka or Mohawk Nation are recognized as the custodians of the lands where I live, work, and study, and did my practicum. I was inspired by the land acknowledgement by the Indigenous Directions Leadership Group for this, and I recommend Googling their acknowledgement to learn more about the past, present, and future relationship of Indigenous people to Montreal.
So why should we research researchers? So in our program, we've learned a lot about a wide variety of best practices and requirements for different kinds of research. So that includes research with Indigenous communities, gender-based analysis plus, and patient and public involvement, just to mention a few. Can someone just recognize that everything's okay?
Yeah, that's good.
And because of, okay, great. Thank you, Victoria. Thank you so much. So each of these has a range of best practices and requirements. So how do we know what researchers are actually doing? How do we know if we change these best practices and requirements, what changes they're actually following? We can look at method sections, but unfortunately, because of word limits, they might not have the information that we're looking for. And this is especially true if a topic is kind of sensitive and it's hard for people to talk about if we ask them directly. They're less likely to volunteer that information. So what really helps, what we often need to do is ask researchers and ask them carefully. Sensitive questions are ones where the people answering the question have a kind of risk involved, and this can be a risk or a threat, and this complicates the research process. So these can be social risks if you ask about things like, racial bias or sexual behavior, then people can then some options will be socially undesirable, and they're less likely to choose those. There are also some questions that create a risk for people's well-being. So if you ask about drug use or sex work, then if that data falls into certain hands, then people's lives can be dramatically affected. So these kinds of questions can increase people's stress when they answer them, and they can either lie on questions, they can choose more socially desirable options, or they could skip questions or your survey altogether. And all of that impacts the information that you're getting and means that you have less to work with as you go forward. There are also some unique challenges in researching researchers. So we're asking them about their professional work rather than their personal lives. This creates new challenges. And on top of that, um, on top of that, uh, some of them might, many of them ask about, sorry, many of them do research in communities that they are part of. So they might have social networks, they might have support networks in those communities, and if research gets out and it's not flattering, then that is at risk. That's on top of professional risks to their sorry to 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 their ethics approval or to their sorry. I'm just going to take a drink. To their ethics approval or their future or current funding. And because they're researchers, I'm actually going to skip that because I don't have a lot of time. So to address these kinds of risks, you can think carefully about how you describe your purpose. So the popularity of peer interviewers can be a lot less sensitive than whether your study used peer interviewers. You can also be careful about how you describe affiliation. So if people think that you're asking from a community that they research, then any questions about the harms to that community are going to be a lot more sensitive. You can also address these kinds of concerns in your introduction and give any information that can be kind of reassuring, like your data will be protected, this group won't see it, things like that. Whatever your affiliations, you can also avoid loaded words. So those are ones where there's an emotional or political baggage attached to it. So for example, researchers are less likely to answer honestly in questions that use the word plagiarism rather than ones that ask about plagiarism but don't use that word. So you can change something like how did you avoid harming a community to how did you manage the effects on a community. You can also use indirect questions that don't ask about specific people or circumstances. You can ask, have you or your colleagues consulted patients without paying them? Rather than, have you heard of researchers consulting patients without paying them? You can avoid restrictive questions. So these are ones where you ask if something is wrong or if people shouldn't do something. And these are interesting because not only can they be sensitive, but if you ask about something that's wrong, then people might think of what else have I done that's wrong, and that can make other questions sensitive. So you can change something like, is it wrong to research a community without involving community members to does involving community members improve research practices? And that kind of unrestricted question will actually make other questions less sensitive. You can also add contextual questions. So instead of asking directly, how did you maintain community researchers' confidentiality? You can also ask, how many did you hire? What were their roles? Things like that. I like to think that that can show that you're interested in the broader context in which they're making these decisions. But research does show that, at least in the general public, this does make questions less sensitive and people answer more honestly. Because we're talking more about evaluation this morning, I wanted to quickly plug the Center for Excellence in Patient and Public Partnerships. They have a great list of tools for evaluating patient and public involvement that I do recommend. However, they studied these and only 7% were tested for reliability. So do take it with a grain of salt and consider adapting them, potentially using some of the ways that I described here. You can also think about testing your survey or evaluation with a smaller group. That can help you identify sensitive questions that you might not have thought of, and also see if you've correctly adapted questions to make them less sensitive. So thank you all so much. I wanted to leave you with one last sensitive question and thank my supervisor, Dr. Zach Marshall, Dr. Victoria Barr, thank you so much, the Shift research team that I did most of my practicum with, and Alyssa, who reviewed an early version of my report. So thank you all so much, and I'm excited to answer your questions.
Well, thank you very much, Andrea. That's a really very, very interesting topic. So are there any questions from the audience? So just to put your hand up, press the icon if you have a question.
For you.
Hi, Jill. Andrea,
Okay, I can hear you now. Sorry about that.
Andrea can't hear, so perhaps we could
hear you now.
chat box.
Oh, I'm sorry. I think she said she can hear now.
Yes, I can.
Yeah.
Okay, perfect. Okay.
So any questions from the audience or any comments that you might have? Lots of comments coming in. If you wanted to actually say those live, that's great.
Thank you all so much.
Jacqueline, you have a question.
Yeah, just a question around when I was working on my project, social location and social identity. I came across a really interesting article about qualitative research and preparing to do that. I'm wondering if you came across any good resources for researchers preparing for qualitative research as far as doing social location, social identity, that kind of work.
Yeah, certainly. That's a great way to show you some of my citations. For that specifically, I would recommend Cursetters. I learned, it describes something from earlier research, which the name I forget currently, but they do reference it, about this idea of the space between researchers and the people that they research, and the ways that it can change during the research process, before it, especially in qualitative work where people might get to know researchers more, and that could actually change whether they see them as more like them or not like them, and how that changes levels of trust and how questions can be sensitive or not. Thank you. That was a great question.